Hi, everybody. I would like to thank you for the invitation to this Congress. It's a registered video because I operate on the same time. The topic of this presentation is about fast-track surgery, specifically in bariatric surgery. My name is Pierre Blanc. I am a vintage surgeon. I am a laparoscopic surgeon for 25 years. And today, I am a specialist surgeon in bariatric and parietal surgery. In our team, we are 7 digestive surgeons. We are 3 bariatric surgeons. We perform approximately 300 bariatric procedures per year. And we use every time 3D vision in laparoscopic and in robotic surgery. We opened 1 month ago our bariatric center. This bariatric center is on the first floor of a rehabilitation center with furniture adapted to obese patients with special colors, a kitchen, a physical activity room, and specific office to avoid any barrier between surgeon and patient. You can see our bariatric activity, more sleeve gastrectomy like all around the world. You can see my colleagues, Dr. Breton and Dr. Solé, and we use every time the Einstein Vision, Bebron, the 3D vision, and robotic SI system. And we develop robotic surgery specifically in robotic gastric bypass. We are an official fast-track center for 4 years. Grasse Center, it's the French ERAS, it's the same, but in French. The first step to implement fast-track, it's very important to have a good relation between physician and administration, of course, and this good relation is for the patient. It's very important to have discussion between administration and physician, doctors, and with this constructive discussion, everybody is winner. There is no loser to implement fast-track surgery. The first step is to have trained in fast-track for surgeon, anesthesiologist, nurse, and administration, because it's very difficult to change habits for surgeon, anesthesiologist, and nurse. Is less complicated for the administration. And it is sure that the patient prefers to be at home than in the hospital. The role of administration is to have good working condition and to take care to the costs, of course. And the surgeon has only 3 points. He can do fast surgery, but without more complication. He has to choose cheaper devices, and he must to implement fast-track surgery. And the more simple is to choose one person to set the example, and in our team, it is the surgeon to implement fast-track surgery. And of course, the team is very important. Without a good team, it's difficult to do anything. We think that bariatric surgery is a good example to implement fast-track surgery because we have time to organize. It is not an emergency surgery. The techniques are standardized, and there is few complications, less 1%. Before this surgery, it's very important to prepare the patient because it's a chronic disease, and obese disease requires a lifetime of follow-up. That is why it's very important to have reflection about the pre-operative, intraoperative, post-operative, and follow-up. And the reflection about fast track start on the visit patient. In bariatric surgery, it's very important to have a good preparation. With a good preparation, the patient has less stress. Of course, it's a laparoscopic surgery, and it's very important to organize the follow-up. You can see in our center, before surgery, we have educational therapy. After surgery, with 1 to 2 days hospitalization, the patient go to day hospital 1 day per week during 1 month, and we have educational therapy after surgery. To implement fast track, it's very important to have reflection about 4 things. Of course, it's necessary to do laparoscopic surgery. It's very important to understand the surgical stress. It's very important to have a notion about publication, and it's very important to have discussion with the anesthesiologist. About evidence-based basins, there is no reason not to fast track anymore. There are a lot of publication, and all publication have the same conclusion. Fast track is easy to implement, and there is no more complication with fast track. The surgical stress is very complicated to understand for surgeons. That is why it's very important to work hand in hand with anesthesiologists. And the surgical stress begins with the first visit with the patient. That is why it's very important to have specific design of office. The stress increase upon arrival in the surgical unit. That is why it's important to have present service, a very good team. And of course, the stress is increased when the patient go to the operating room, and in our clinic, the patient walk to the operating room. You can see our surgical unit. It's a present service. The patient can eat together, can work, can measure the work in the surgical unit. And you can see our bariatric center with pictures, with models, etc. To implement fast-track surgery, you must do laparoscopic surgery because it's minimal invasive surgery, less aggressive. The recovery is faster. The patient return to work faster, and the surgeon see better. And we perform for 10 years a lot of surgery and less than laparotomy. The advantage of the fast track is for the surgeon and anesthesiologist, because we have a reflection about simplification, standardization. Advantage for surgical unit for the same reason, and for the administration because there are less expenses and more profit, and it's a good publicity for the institution. There is none disadvantages to implement fast-track surgery. Of course, you have to do it gradually and naturally in the theater room with the same procedure, same installation for all surgeons. You have to do infiltration because before incision, you have to not use any drain or any gastric tube. We choose cheaper device from China, and we use everyday 3D vision. You can see an example of installation. We are 3 bariatric surgeons with only 1 installation like this for all bariatric surgery. And we use 3D vision. There are a lot of publications compare 2D versus 3D vision. The conclusion are the same. There is only advantages to use 3D vision. The surgery is better safety. There is less risk of hemorrhage. The team is less tired. We can operate in small spaces. The performance is increased for vintage and young surgeon, and the dexterity is increasing even for vintage surgeon like me. You can see the Einstein Vision 3.0 from Baybone Esculap. It's the better 3D vision in the market. We use specific glasses, clip or mask. It's a large screen. There is no smoke with the filter efficient against the COVID. You have some arrangement. It's a monoblock system with no sterilization, and the camera is very light. And the surgeon has a screen, the anesthesiologist has a screen in 2D vision, and you have a specific box to place the camera to avoid any damage. In surgical units, it's very important to have a present unit. We place sealant. There is no stapler on the skin. The patient get up and drink water on the same evening. The patient treadmill from the day after the surgery. The patient eat mixed food on the first surgery and is discharged on the first or 2 post-operative day. And to do this, it's very important to educate the patient before the surgery. That is why the patient is in center of the project. The patient must know what will happening during the hospitalization. And the patient can call if there is any problem. A specific number is the SOS obesity. And we learn to and with Fast Track, the dogmas fall. Even with an anastomosis, we can drink in the evening, we can eat on the first postoperative day, we can give anti-inflammatory drugs for the pain, and the patient can leave the hospital on the first day without more complication. And of course, if your colleagues have any problem to implement Fast Track, the patient convince your colleagues, convince everyone. You can see the evolution of our organization to implement the Fast Track. It took 2 years to set up the Fast Track without increased complication. And it takes 10 years to have our bariatric center. You can see 10 years ago, we performed 50 procedures. The hospital days was 7 days. 2 years after, we perform more 100 procedures with 2 days hospital stay, and with very low complication, we can develop robotic surgery, endoscopic surgery, and we are a center of excellence to perform bariatric surgery. Take-home message. To implement Fast Track, it's very important to think about the entire patient journey. The aim is to decrease the hospital stay with the same or better quality without more complication, and the patient must be in center of the project. The discharge is prepared before the surgery. Everything is given to the patient, and we use also testimonial for former patient. In conclusion, Fast Track surgery is just an evidence. Fast Track surgery allows to progress. Fast Track surgery doesn't prevent from developing other techniques. The patient are dealt with this care. Fast Track surgery allows to increase recruitment, and with Fast Track surgery, everyone wins. I would like to thank for the invitation. If you have any question, you can send a mail, and I wish you again a good Congress. Thank you very much for your attention.